Hey there, everyone. Welcome back to Shock Doc Medical, the podcast where we dive headfirst into the latest and greatest in medical research, always keeping it real and hopefully a little fun along the way. I'm your host, Dr. Rod, and today we're talking about a super interesting study published in the BMJ that looks at the risk of stroke and heart attack when using modern forms of hormonal contraception. If you're a doc, a med student, or just a curious soul, buckle up, because we're about to break it all down step by step. So let's set the stage. The study was carried out in Denmark, looking at women aged 15 to 49 who used different types of hormonal contraception. The big question? Does using contemporary hormonal contraception, whether it's the pill, the patch, an IUD, or implants, crank up your risk of stroke or heart attack? We already kind of know combined oral contraceptives might come with some risk, but what about newer methods or progestin-only products? That's what they wanted to figure out. They did a real-world, nationwide prospective cohort study. Fancy way of saying they basically followed over 2 million Danish women for a bunch of years, checking prescription records, hospital data, and so forth. They left out anyone with major conditions that might confound the results, like known clotting disorders or cancer. Then they looked for first-time incidents of ischemic stroke or myocardial infarction. That's pretty thorough. Love a good nationwide registry. All right, so the big reveal. Over about 22 million person-years of follow-up, which is a mind-boggling number, by the way, they recorded 4,730 strokes and 2,072 heart attacks. They found an increased risk with most hormonal contraceptives, especially those with estrogen. Combined oral contraceptives had about double the risk compared to non-users, while progestin-only pills also showed a bump, but it was smaller. Interestingly, the levonorgestrel intrauterine device, IUD, didn't seem to increase risk at all. So the authors wrap it up by saying, yes, we see an increased risk of arterial thrombosis, strokes, and MIs for most modern hormonal contraception, though the absolute risk is still low. But if you're prescribing these methods, you gotta keep this risk in mind, especially with estrogen-containing options. I gotta say, I like the design. They used national registries in Denmark, which are super robust. Prospective data means they track you going forward in time, so it's less prone to recall bias. But we should ask, is the data from Denmark generalizable to the rest of the world? Denmark is relatively homogeneous in terms of ethnicity and has a solid healthcare system that might limit applying these findings to more diverse populations or places with different healthcare structures. The numbers are big, over 2 million women. That's huge. They did Poisson regressions to figure out incidence rate ratios, which is appropriate for this type of data. They also adjusted for a bunch of confounders like age, comorbidities, and so on, which is good. Still, there's always a possibility of residual confounding, like maybe lifestyle factors or less documented risk factors. I'd say the study's pretty strong in validity. They used objective outcomes, stroke and MI, from hospital records, which is better than self-reported data. Reliability seems high given the registry-based design. But can we replicate this in a population with, say, different genetics, different diets, or different healthcare systems? That remains to be seen. Like I mentioned, Denmark's demographic might not reflect, say, the US or parts of Asia. Also, they temporarily censored women for pregnancy or surgeries. Makes sense to isolate the effect of the contraceptives, but there might be complexities we're missing. And of course, there's always the question of how accurately prescribing data aligns with actual use. You can pick up a script, but not necessarily take it consistently, right? Historically, we've heard about the clotting risks from older studies on combined oral contraceptives. It's not totally new. What's cool is they included more recent products like the patch, vaginal ring, and different forms of progestin-only methods. Some other studies have shown conflicting results. Some found no increase, and others found a mild increase. This one is definitely adding more weight to the argument that, yes, there is some risk, especially if estrogen is involved. For clinical practice, it basically means don't freak out, but do be mindful. If you've got a patient with multiple risk factors for cardiovascular disease, like smoking, hypertension, or maybe they're over 35, these findings underscore the importance of reviewing safer alternatives. The levonorgestrel IUD might be the better choice for them. You can still prescribe pills or patches, but informed consent is key. Discuss the potential for an increased stroke or MI risk. This might push guidelines to keep reinforcing that if a patient has any elevated cardio risk factors, an estrogen-progestin combo might not be the best. Also, we'll likely see more calls for research into progestin-only implants and injections, since the data there show a potential increased risk, but is somewhat limited. All right, so some questions that pop into my head. Should we be screening young women more aggressively for cardiovascular risk factors before prescribing these methods? And could there be genetic markers that predispose some women to a higher risk? I'd love to hear from you guys, especially if you're prescribing these regularly. Have you changed your practice at all based on new data? Let me know. Drop me an email, DM me on social, or toss your thoughts in the comments below. For me, as a doc, I'll be talking more openly with my patients about these findings. Low absolute risk is still important, meaning these events are rare. But that conversation about personal risk factors should happen. Also, if you have a 37-year-old smoker with borderline hypertension, maybe talk about the levonorgestrel IUD or a non-hormonal method. All right, folks, that's the scoop on this major Danish cohort study about stroke and MI risk and modern hormonal contraception. Big thanks for tuning in to Shock Doc Medical. If you got value from this chat, please like, subscribe, and share it with your colleagues. Let's keep this conversation going and push for better patient education. Until next time, stay curious, stay informed, and take good care of yourselves and your patients. This is Dr. Rod, signing off.